Welcome to Trial Site News Roundup. Today we're going to be talking about the pandemic turnaround in Uttar Pradesh as cases decline dramatically. Then we're going to head here to the US and talk about the University of Minnesota with their COVIDOUT Factorial trial, which is investigating the potential for Ivermectin, Fluvoxamine, and Metformin against early onset of mild to moderate COVID-19. And so, from Trial Site News, I'm Adrian, and our episode starts now. So, the health authorities for the state of Uttar Pradesh are easing up on COVID-19 based restrictions, at least in zones of the state where SARS-CoV-2 infections now fall below 600 cases. So just how big of a turnaround is the situation there? Well, from much of February and March of 2021, the average number of cases ranged from 100 to 350 in the most populated state of India with over 220 million people. Now that situation changed with the second pandemic wave there, which, as we showed in an analysis, suggests that started with a potent mutant variant in combination with migrant labor's fear of imminent urban lockdowns, triggering migration and hence rapid viral spread. So, by March 19th, the state had 380 cases and the numbers of newly infected cases skyrocketed to 37,944 cases on April 24th alone, just over a month later. Now, the state was already offering ivermectin as part of a population-wide regimen, but the health authorities there doubled down on their efforts as India's national COVID-19 guidelines introduced ivermectin just days before. Now, what followed this is nothing short of amazing, but unfortunately, it's attracted little media attention outside of India. Now, what happened is, just as fast new cases materialized, so has the decline, thanks in part to a coordinated public health strategy that included proactive testing, home visits, and medication kits that did include ivermectin. Now, as of May 29th, the number of estimated new cases declined to 2,014, representing perhaps the steepest decline of new cases and the fastest positive turnaround of any nation anywhere. Now, this curve does look similar to what also occurred in Zimbabwe and other places that instituted a population health scheme involving home care and therapies such as ivermectin. And so, thanks to this dramatic turnaround, authorities there can ease up pandemic restrictions in zones with under 600 new cases recorded daily. Now, as we here at Trial Site News have reported, the state's health department, led by Dr. Anshul Parikh, General Medical and Health Services, became the first state across India to declare ivermectin in large-scale prophylactic programs with a focus on close contacts of COVID-19 patients, health workers, and general care of COVID-19 patients. Now, Parikh and team started the effort in Agra and observed markedly successful results. Those findings led the state government to accept the use of the regimen for all COVID-19 patients and, over time, established the optimal dosages for the patients. Now, there are similar observations that are happening in Mexico, Bangladesh, and even countries such as Zimbabwe, where ivermectin is in use widely to fight off COVID-19. Of course, it should also be mentioned that there is no meta-study authoritatively proving the complete correlation, but the real-world data most certainly is candidly observable. So the question then is, why aren't health authorities and media discussing this? Is this not newsworthy? Now, additionally, we should note that there are less than 2 million people that have been vaccinated in Uttar Pradesh, yet this remarkable turnaround has happened nonetheless. The state still seeks vaccinations and therapies, such as ivermectin, not authorized or recommended other than in clinical trials in many parts of the world, including here in the US, and is used in conjunction with vaccination and other public health measures during pandemic times. Now, the World Health Organization recently showcased the incredible progress there, yet for some reason omitted the fact that ivermectin was a centerpiece of the strategy. Now, this seems to be an odd repression of vital information, especially in the midst of the worst pandemic in a century. And of course, as always, we will keep you posted on this story as it continues to develop. So for this next story, we're going to talk about the University of Minnesota, which recently added generic study drugs to critically important, yet not widely known clinical trial investigating outpatient treatment for SARS-CoV-2 infection, which of course is the virus behind COVID-19. The study, led by Carolyn Bramante, called the COVIDOUT clinical trial, targets an incredibly important segment of the COVID-19 disease spectrum, which covers approximately 90% of total cases that fall in either the asymptomatic or mild to moderate symptomatic category. Now, at present, there are no authorized treatments for this massive population. Now, while there are a few pharmaceutical companies, such as Merck and Pfizer as well as AstraZeneca, that are testing therapies that target this lucrative market, around the world, other generic drugs are either under investigation or are in use, such as Ivermectin, Favipiravir, and others. So let's take a look then at the study drugs. Well, the University of Minnesota sponsored study looks at 3 generic low-cost potential drugs targeting COVID-19. Now, a reminder from us here at Trial Site News. Currently, none of these generic therapies are authorized for COVID-19 here in the United States by the FDA, nor recommended by the National Institutes of Health. Now, Metformin. This drug was discovered in 1922. The first-line medication is used for treating type 2 diabetes with a focus on patients who are overweight. The drug is also used for polycystic ovary syndrome. The University of Minnesota included Metformin in the study due to a number of data points, such as a University of Alabama at Birmingham study indicating that the use of Metformin prior to COVID-19 infection may reduce the death rate. The study results were peer-reviewed and published in Frontiers in Endocrinology. Then the next drug is Fluvoxamine. Now, this drug is currently approved by the FDA as an antidepressant of the selective serotonin reuptake inhibitor, or the SSRI class. The drug is used for the treatment of depression disorder and obsessive compulsive disorder, or OCD. Now, it should be noted that we here at Trial Site News have also been following fluvoxamine studies, including one led by Washington University St. Louis School of Medicine and funded by the COVID-19 Early Treatment Fund, which was created by a frequent contributor to our website, tech entrepreneur Steve Kirsch. And as a side note, fluvoxamine's potential was also showcased on 60 Minutes recently. And then finally, the third drug is Ivermectin, which, for those of you who watch this channel regularly, know that we have been monitoring Ivermectin-based research more than any media platform worldwide. Now, this drug was first identified by Australian researchers as a possible candidate for drug repurposing way back in early of 2020. The developed world, however, showed little interest, but research and actual care options took off in numerous low and middle income countries, from the compelling work of Dr. Tariq Alam of Bangladesh to numerous initiatives in Peru and Bolivia. So now let's talk about the Factorial randomized study. What precisely does that mean? Well, when we reached out to the University of Minnesota physician and principal investigator, they explained to us that a Factorial trial involves 2 or greater investigational interventional comparisons executed in parallel. A majority of this class of trials includes 2 factors. Each of them has 2 levels known as 2x2 Factorial trials. However, this class of trial can include 3x2 trials, or even such studies that may investigate 3, 4, or greater interventions, all in parallel. In the COVIDOUT trial, 5 active treatment arms are being compared to the same placebo arm. Thus, only 17% of participants will receive a placebo. This class of clinical trial, if designed properly, can offer flexibility and economy as it facilitates a couple of different studies for the price of one. Mostly, these studies are designed and executed in such a way that the effects of the investigational interventions are not based on an interaction between 2 or more study drugs. However, Factorial studies can involve a pursuit to assess the benefit of an interaction involving 2 investigational interventions. Now, for those interested in participating in this study, just head over to the website covidoutt.umn.edu, which of course we will provide a link in the description below. And that, my friends, brings our episode to a close once more. As always, thank you so much for being here with us today. From Trial Site News, I'm Adrian, and I will see you all next time.